Hey gang, remember a couple of weeks ago I sent you a case where we did some connective tissue grafting on number 27, and we basically showed how to do the graft. What I wanted to do was just show you how we diagnose it and just give you little tidbits on how you and your hygienist can measure for recession and really try to figure out how much attached gingiva there is around teeth. So let me show you this wonderful young lady. She's got some recession on number 6 that we're going to treat today. So I just want to show you how we measured for her attachment level and give you a little better idea, because it's really something that's kind of not, we haven't been taught that really well, so maybe this will help clarify some things. So come take a look and I'll show you exactly what we're going to do and how we measure this to determine what we should do in this area. So in number 6, she's got some pretty extensive recession, approximately 4 millimeters on the facial. So again, we're going to measure from the CEJ to the marginal gingiva. So that's the amount of recession that she has. You can tell she's had some flattening of the root. I do not think it's from toothbrush abrasion. I think that isn't all that common, quite frankly. It's more of a genetic predisposition that she doesn't have a lot of attached gingiva. So what we would do is we'd measure this pocket, and really her pocket depth's about 2 millimeters. So you can almost see the ruler go underneath her tissue. But what you look for is you measure the pocket depth, and then you were to put the probe horizontally and push up in a vertical fashion. And when you see the tissue fold over, it's called the mucogingival junction. You can measure from that pocket depth to the mucogingival junction, and Aaliyah, there's really no attached gingiva. So if we move to the adjacent tooth, we'd measure a similar 2 millimeter pocket. We'd measure horizontally. Now the attachment stops right here. See how the tissue stops moving? So now she has approximately about 5 millimeters of attached gingiva, because we eliminate the 2 millimeters of the pocket depth. So if we drop down to there and go to approximately where the mucogingival junction is, then we know she has about 5 millimeters of attachment. And lo and behold, she has no recession, and she probably never will, because it's this zone of attached gingiva that helps protect our tissue, our underlying bone, and keeps the roots from receding. So when you see somebody that you're determining whether they would benefit from soft tissue grafting, just measure the pocket, put the probe horizontally, and measure, push up and just kind of see how much attachment there is. And if there's less than 3 millimeters, then a lot of times you need to really monitor those areas, and something like a connective tissue graft may come in handy, especially if it's a bridge abutment, a partial abutment, or even an implant. We know more about that. We're learning more about that as time goes on. So I hope that helps, and I hope you all are doing great.